name's Cheyenne. I'm a student here at the College of Nursing, and I'm going to be performing the trach care. I think I'm starting from step 20, I think. So I already have my sterile filled up, my saline, everything good with my patient, and I already have all my PPE on, and I would be having a gown on as well. Okay. So we're going to remove the inner cannula and drop it in, and remove the soil thing and replace my patient's trach. So now that is in, I'm going to remove my clean gloves, perform hand hygiene, and don my sterile gloves. Okay, now that I have my sterile gloves on, I can rearrange my stuff on my sterile field, but it just has to be within the 1-inch borders. Okay, so now that my inner cannula is in the water, I'm going to pick it up and grab my brush. I'm going to make sure not to get my sterile field wet, and I'm going to clean the outside of my inner cannula, and I would clean the inside. Oh, it fits okay. With that, and I'm going to throw that away. And I'm going to take this and I'm going to rinse it in that saline right there. I'm going to pick it up and take it out and dry it with a 4x4. Make sure not to dry it over my sterile field. I'm going to get my pipe cleaners and dry the inside of it. Now that my inner cannula is dry, I'm going to replace it. I note that when I took it out, I would go from 6 to 9, and now putting it back in, I'm going from 9 to 6. 9 to 6, holding the faceplate, making sure I stabilize the faceplate. Now it's 9 from 6. I'm going to take my Q-tips, making sure that the end stays sterile, dip it into my saline, and I'm going to clean the stoma. While I'm cleaning the stoma, I'm going to check to make sure there is no skin breakdown, erythema, redness, any of that. So I'm going from the closest part of the stoma out. I'm going to drop. And good on the other side, closest from the stoma. And out. So now that is done, I'm going to take my gauze, dip it into my saline, wring it out, and I'm going to clean my faceplate. Clean the faceplate and the outer cannula. Throw that away. And now I will pat it dry. Okay, and I'm going to pat the excess around the skin dry. Okay. And now I will do the trach ties before removing the old ones. If you hear any screaming, that is my nephews playing. I will double the string up, lift the patient's head, go under, pull it up. I will make sure that the trach ties are not too tight, and normally I would tie it. If I would tie it too tight, that it was too tight on the crowd, but I would tie it in a knot, and then, but my string just isn't long enough. Now I'm going to take the clean drain sponge. I'm going to place the clean drain sponge up under. Then I'm going to remove the old ties. Normally I would just cut the old ties, remove them, and replace my patients with oxygen. Now I'm going to remove my gloves. Perform hand hygiene. Place my clean gloves on. And I'm going to perform oral care with a chlorhexidine probe. I'm going to perform oral care with the CHG and then normal oral care. Then I would auscultate lung sounds. I will remove the towel, auscultate lung sounds. Compare it to my previous assessment, respiratory assessment. I'm going to raise my patients' side rails, lower their bed, make sure their head stays above a 30-degree angle. Clean up my supplies. Take my gloves off, remove my gloves, remove my goggles, remove my gown, and then remove my mask, but my mask is taped down so my goggles would not fog. Perform hand hygiene, and then I'm going to document. I would document the size and type of trach. I would document if there was any skin breakdown, the respiratory assessment. I would also document how my patient responded to the procedure.